Hello, my name is Natalie Hawkins. I'm a physical therapist and an instructor with the Integrative Dry Needling Institute, and I wanted to share with you how I utilize dry needling to help with the patient who had functional neurologic disorder. FND, also known as conversion disorder, is a neurologic movement disorder caused by abnormalities in how the brain operates and functions. The key in FND is that there's no structural damage present in the central nervous system. It's more of a hardwiring issue that's causing these deficits in these patients. Some impairments may include cognitive issues, sensory loss, and motor loss. Oftentimes, FND is triggered by a psychosocial trigger. One of my coworkers was treating a patient with FND and not getting the results that they were looking for, so I offered to help. She was a 15-year-old female. Her onset began in March of 2023, where she woke up in the middle of the night with severe left-sided abdominal and low back pain. She also had complete paralysis of her left lower extremity and full sensory loss. Her mom rushed her to the ER because they thought she was having a stroke. They performed a MRI of her brain and lumbar spine, which came back normal, and she was sent home with the diagnosis of conversion disorder. At her initial eval, her left lower extremity manual muscle tests were 1 out of 5. She presented with hyperreflexia in the left lower extremity. Sensation to pinprick was intact in the dorsum of the left foot, but the remainder of her lower extremity was insensate. Her mom had heard that I did dry needling on people and asked if I could influence her motor function using it. And I thought of this case report that I had stumbled upon that was written in 2021. They took an individual who had had a stroke 2 years ago and performed dry needling on his thenar eminence on his right upper extremity, the involved side. What they found after looking at his pre and post functional MRI was that there was increased activation of the primary and supplementary motor cortices after dry needling him for 1 minute. So my thoughts are, if dry needling could influence this individual who had a stroke 2 years ago, whose nervous system isn't intact, surely I can have some degree of an effect rewiring this girl's healthy nervous system. So where I started was we initiated treatment 3 months after her symptom onset. We needled her once a week for about 4 weeks, and I focused on the paravertebral points that correlated with her sensory and motor loss. So basically her L2 through L5 vertebrae with 2-inch needles, simple insertions, no manipulation. I couldn't needle her involved extremity because it was insensate, but I did needle along the homeostatic points on her contralateral limb because they do share neurology at the level of the spinal cord and brain, and I hoped that that would improve some degree of connectivity and reduce systemic inflammation. As we needled her week by week, there was improvement in her sensory on the involved side, and I added those homeostatic points as well. After 4 sessions of needling and continued physical therapy and exercise, this is her gait. So that's pretty cool stuff. So my hope is after seeing this case study of mine, you start thinking of needling in a different way. Don't think of needling as only a way to manage pain or tight muscles, but it's a way to needle the brain and influence how we function. You could use needling to improve motor control in your ACL patients with quadriceps motor control deficits. Or you can needle your patients who have had a stroke and are having issues with range of motion, initiation of movement on that involved side. The possibilities are endless. Thanks for watching.